So let me ask you this question. We all have a system that we run our business in, that we run our practice in, our businesses, whatever that system is. Okay. Will our present system support our future growth?
That's obviously going to vary from practice to practice. It depends what you mean by systems, I suppose. Do you mean
Okay.
the patient handling software, the electronic database?
Everything.
Yeah.
Everything. How many rooms you have, how many people you have, the
Okay.
software you're using, everything. In fact, let me ask you this. If you're doing everything right, okay, if you're doing everything right and you're really helping people, would it be natural for your practice to grow?
Yes.
Okay, because in general, if people are happy, they refer.
Yes.
So if we're doing it right, whatever that is, would our practice grow? Yes. Will our present system support the future growth?
I suspect for many people, the answer will be limited by the number of rooms they have and the time which they allocate to patients.
Sure. Because let's just say you have however many rooms you have, but you keep helping more people and you keep growing.
Hmm.
So now I either need more room, I need more tools, I need better techniques, I need different software, I need more people, I need more associates, I need more, right? I need more and I need more until I draw a line in the sand and say, that's all I want. Now, you may draw a line in the sand saying, I want to be a solo practitioner and I want to see this many people, and that makes me happy. And then we go wait list. So probably about a third of the practices that I coach right now are wait listed anywhere from a month to one gal is wait listed a year and a half out. You cannot get in to see her for about a year and a half. Okay. The headspace that we've gone through with her for getting waitlisted right at the beginning to a year and a half has been very interesting because she goes through all this anxiety of people calling that want to see her and she can't help them. And a good patient and a good friend has their husband that wants to come in. So there's always headspace and procedural issues here. But I'm just saying that if we're truly helping people and we're doing a good job, the business will grow. If the business grows,
Yeah.
our present system will not support our future growth unless we decide that's it, that's all I want, I don't want to grow anymore.
Yeah.
And that's what we call waitlist. Now, waitlist is a wonderful place to be. It's a joyous place to be. Imagine you've got 2 or 3 or 6 months out before someone can get in and see you. For many of us, that brings us stress and anxiety. But once you get past that, it's such a stable, wonderful place to be. Now, if you like running an acute practice where people are in crisis, you can't do that. But
Hmm.
if you're not running an acute practice where people are in crisis and you're more focusing on function and health, which is more of my focus, and not that the other is wrong, it's just not what I focus on, then this is a
Yeah.
wonderful, stable place to be because there's way more demand than there is supply, meaning we must continually reorganize and then fill it. So we
Yeah.
make space by reorganizing and then we fill it and we make space and we fill it and we make space and we fill it until we're as full as we want to be and we say that's it and now we go wait list. So far so good.
Absolutely. Yeah. And I know, as you've already implied there, that there will be people watching who will say, "Well, hang on, I can't. How can you manage patients if your waiting list is a year and a half long? Because they're calling because they're in pain." So and that is the way most of us operate here, which means we're running an acute practice, as you described it, which I guess means we have to have alternatives for them to give them good treatment. We have to be able to recommend where they do go.
Sure. Yeah, yeah. So definitely you want to have other people that you can refer to. So for the practitioners that I work with, they are looking at when they're looking at function and they're not just helping people out of pain, but they're also helping them get functioning better. You and I
Yeah.
have talked about this before with this chart right here. So
Yes.
we're going to get you out of pain, but we're going to get you functioning at your optimum. So let's just take a look. There's an osteopath I work with in New Zealand, and one of the things I've really helped him get better at, and his practice has really grown from this, is he was just helping people get out of pain. And he was proud, 2 or 3 visits, they were out of pain. And I showed him a whole bunch of different myotome tests and motor tests, kind of things, myotomes, motor tests. And I said, when you've got someone feeling better, what I want you to do is I want you to take these objective tests and tell me if they're all clear. And he came back to me and he said, wow, like nobody was all clear. So let's just check, we check the psoas or we check the TFL, right?
Right.
So you check the psoas, you check the TFL, you check the hamstring, and those are blown out. Those are not functioning right. And they're playing tennis. The odds of them going and injuring themselves are very high. So what we started doing was asking people, I'm happy to get you just feeling better, and I'm happy to get you functioning at your optimum. And we would know because all these tests would be strong, they would be clear, and you would be coming back in with them strong. And then we'll see you in a couple of weeks. And if they're still strong, we'll see you in a month. And if they're still strong, we'll see you in 2 months. And what he found was, especially with athletes, nobody was making it that long because they're injuring themselves all the time. The question is, they're doing micro injuries before they have a macro injury, right?
Yeah.
So for
Yeah.
him, he started filling his practice with people that wanted to prevent injuries, to recover faster, and have more personal bests. And from a marketing perspective, that became his mantra. So now these people are sticking around, and every once in a while there will be an acute person coming in, but he can hardly handle any more new people because he's got such a full practice of people who want him for this service. Again, I'm not saying that's better than that. I'm just saying it's different than that.